Hey everybody, this is Dan Wright from Wright Physiotherapy. I am doing another educational video for all of you folks at CrossFit Torsion. If you have some low back pain or hip pain, I want to go through just a few exercises that tend to be really helpful, and they are not hard, but they are exercises or strengthening exercises that help engage the deep core and some of the hip muscles that with a lot of the high intensity exercises that you guys tend to do, sometimes these muscles kind of get missed or they get overpowered. So the first exercise, and most of them can be done, it's just you lying on your bed or on the floor. The first exercise is called the isometric abdominal. So what you do is you have your feet, your knees bent, your feet flat on the bed or table or floor, and you want to squeeze the stomach muscles really tight. And I always describe it as almost as if somebody's going to punch you in the gut. You squeeze the belly muscles to brace or to support yourself. So you have this isometric abdominal position. You hold that tight, you never let loose. And as you hold it tight, I like to have you monitor your what's called the ASIS bones. It's part of your pelvis. And so the stomach muscles are tight, you're kind of feeling the bones, and then you're doing an alternating knee extension. Back and forth. And you're trying to hold the stomach muscles so tight, you are not letting the pelvis rock all over. You do not want the pelvis to rock. We're trying to create stability of the lumbar spine, the transversus abdominal muscles, and the deep multifidus muscles. They work in conjunction or together to help decompress the spine, to stabilize the spine. And so you would do 3 sets of 15 of this nice controlled stomach squeeze alternating knee extension. So that's the first one. The second exercise is called a bridge. So you have your heels down, and then you squeeze the rear end muscles to lift your rear up off the table. You hold that a second or two. I say you land it, and then you can nice and control back down. Squeeze the butt, you hold them tight, nice and control back down. So that is a low back extensor and a glute max strengthening exercise. And you would do 3 sets of 15 of that also. Very good exercise. Easy, but good. The next one is a clam exercise. So you have your feet together, your knees bent, your hips flexed. You don't want to be tipped back, but you're completely straight up and down. And then you want to lift the knee up as high as you can using just your hip muscles. You up and down. Really important exercise, especially if you're having rear end pain or hip pain that often can be generated from the low back. And these muscles get really weak and they become inhibited and they kind of shut down. So again, you would do 3 sets of 15 of this. And to keep it even, you would do it on both sides. Now the next one, it's called a straight leg raise into abduction. So you have your leg completely straight, and then you're lifting it straight up to the ceiling. Just like that. And what you don't want to do, again, you don't want to tip back, and you don't want to take the leg forward. That is not what we're trying to do. We're trying to engage the glute medius muscles that lift straight up. So you could lean up against a wall with your rear end on the wall, your heel on the wall, and your shoulder blades on the wall, and you would slide that heel right up along the wall. That can help keep your form. And you will feel that muscle work and muscle burn in the side of your rear end here. Again, it'll be 3 sets of 15 of that. We're going to make this nice and easy. And then the last one is being on your stomach. And that's, again, it's for the glute max exercise, or the glute max muscle. You have your knee bent, and you try to just lift it right up. Squeeze that butt muscle, and then you bring it back down. You lift and squeeze, and back down. And you would do that 3 sets of 15 on both sides. So those are not difficult exercises, but they're really important exercises that I would typically give you depending on what's going on dysfunction-wise of your spine or your hip, but they're a good place to start. So it's it'll keep your low back healthy. It'll keep your hips strong and healthy, and they're just muscles that tend to get really easily missed with all of the intense training that you guys do in CrossFit. So just don't leave those out, and it will definitely help your performance and your activities. Again, so this is Dan Wright. If you have any questions, you can leave a message at the bottom of the post, and hopefully that will be helpful, everyone. All right, thank you. Bye.